we should stop this one and then we start another record. Let's see, just 1 second. No, we continue. Okay, now we started the second part. Let me introduce Dr. Sun. Dr. Sun graduated from the first juvenile class of Shandong University of Traditional Chinese Medicine in 1993. From 1993 to 1999, she studied for her master's degree and PhD degree in TCM. In 1999 to 2001, she was working in the Department of Cardiology of Shandong Province TCM Hospital, and also served as a lecturer in internal medicine teaching. Since 2001, Dr. Sun has been engaged in the clinical work of traditional Chinese medicine in the UK. In 2017, she began to follow Professor Yin Hongchun's modern tongue diagnostic study and achieved big improvement with clinical diagnosis and treatment levels. She is currently the academic director of the Federation of Traditional Chinese Medicine Practitioners. It's called FTCMP, the Secretary General of the International Modern Tongue Diagnosis Association, the Vice President of the TCM World Federation of Hypertension, the Vice President of TCM World Federation of Antivirus Research, and the Director of the TCM World Federation of Mental Disease. Now let's say welcome Dr. Sun.
Hello, everyone. Thanks for Professor N's introduction. Today, we are going to introduce quite a lot new knowledges and informations. So if it's the first time you contact modern tongue diagnosis, you will possibly receive a brainstorm. If you missed anything or couldn't remember something, don't worry, we'll organize training courses after this lecture. And Professor Yin just posted the messenger code and also the WeChat code, so you can scan it and join our team. So next time, I'm going to introduce the modern tongue diagnosis.
那个也那啊，出来，他在洗手间，在洗手间，在洗手间。
Let's go. Okay. So yeah, we know that modern tongue diagnosis have quite a lot unique like tongue reading method and treatment, including acupuncture treatment and herbal treatment method for our clinic diseases, especially for gynecological disease. We have our unique like 冲任督带 meridian disorder signs from the tongue. We also have a unique 16 division in the tongue, which you can find out like 阳明、太阴、少阴、少阳、厥阴 in a different area, different signs of the problem, especially the triple warmer meridian is quite important for gynecological disease. So we're going to put some effort for this. And we also have a special 10 outlines of syndrome. You know the 8 differentiation syndrome system, which is yin yang, heat and cold, deficiency and excess, interior, exterior. With the modern tongue diagnosis, we can find the qi movement in the tongue, which Professor just explained some brief idea in the previous lecture. So, which means the qi descending and ascending movement can shown on the tongue, which we add to the 8 outlines of the differential syndrome. So comes with 10 outlines of differential syndrome. And also we use Zangfu differentiation. And for example, it can give us quite clear idea about the heart, the spleen, the kidney, the liver, deficiency, blockage, and other conditions. So we can also have a clear idea, which help our diagnosis in the clinic. And you know, when we diagnose a problem, and when the patient comes to the clinic, the main complaint possibly like back pain. But after you take tongue picture, you can see quite a lot of information. Obviously, you can have a quick look, like what caused the back pain. And it could be yang deficiency, it could be blood stasis, could be qi blockage. But apart from that, we can find out quite a lot of things. And for example, this picture, the patient come for the clinic for back pain. And from the tongue reading, you can see, well, there's a flat tongue tip, which shows the patient not sleeping very well, and also a little bit redness here. There's a little bit bulging of this area, which from Dr. Ing's holographic picture, this could be the breast condition here. So when you ask the patient, he will say, oh, I just get a breast cancer and go operation already. So you still can see something not quite right from here. And the middle area, B is the heart condition, which is a big crack, and also the sunken and dark condition here. You just can ask the patient, sometimes you feel bad palpitation or heavy chest. And C is the stomach spleen area, which also looks quite heavy coating, and also goes to here as well. So the patient will see, oh, my stomach is not very well as well. So from here, not only gynecology problem, and every patient come. So after the main complaint, you can also find out other problems, which means after you cured his back problem, you can continue to treat the other problem, sleep disorder, stomach condition, and other health conditions as well. This is another example, so which you can see in the clinic. This patient come for anxiety, and the tongue shows quite a lot of things here. which means the side and the top bit are bit red. It's a sign of the liver fire and also the heat in the heart, which all means like the anxiety could be the problem here. And also this patient has again a big crack in the heart area, which you can ask continue like any palpitation. This area shows the cervical condition not quite right as well, and the stomach a big sucking condition. So sometimes and heavy coating here. So sometimes the stomach could be a bit upset, and the lower part a big sucking condition, and the coating is quite heavy again. Which shows the kidney deficiency and also can be a lower back problem. There's a little bit bulging here, which could be the fibroids or cyst, like ovary cyst condition. Well, this patient confirmed most of our concerns. So after this, you will receive like the patient will feel really confident about your treatment now, because you can see quite a lot of things before he tell you his diseases, history, and symptoms. Okay, we start from the REM meridian disorder. And for gynecology problem, REM meridians is very important. And this meridian originating from the uterus and is the seat of the A meridians. And also it meet the 3A meridians as well. From 内经素问, it mentioned REM meridian disorder, the woman will bring down discharge, like one symptoms. Another, it mentioned the abdominal mass. This could be the uterine fibroids, like the ovary cyst, or it could be endometriosis condition. It can all show some sign from the tongue. We are going to discuss what will be it. For the REM meridian disorder, we have two different signs. One is deficiency syndrome, which is the left one, which shows the root of the tongue is bulging. Sorry, I think the PPT gets a little bit problem here. For the deficiency condition is this one. You can see the midline of the tongue is sucking, which in the middle. And also the like the tongue root is a bit sucking. That's the problem. Shows the deficiency condition of the REM meridians. The picture here on the right, which shows the excessive syndrome of REM meridians, which is the midline, you couldn't see anything wrong, but the tongue root here, the root tongue is a bit bulging, which shows the lower jaw get cold and blastocysts. So quite a lot of gynecology condition can have the problem connect to the REM meridians. This is a patient with infertility and also 2 miscarriages in the past year. From the tongue reading, we can see the middle line is obvious deficient sucking condition here, and which shows spleen kidney deficiency. And also from the side of the tongue, you can also see some liver blood deficiency as well. So we give the patient treatment concentrate on the REM meridians and the kidney, spleen, liver meridians as well. So the acupuncture point we choose here气海关元 is from the REM, 中极气海关元 from the REM meridians. And we also choose 太冲 for the liver, 太溪 for the kidney, and 天枢 for the spleen. So we also can choose the Chinese herbs according to this diagnosis as well. This is another patient came to the clinic for headache and sleep disorder. Well, this patient is only 15 years old. When I took the tongue picture, you can see a very obvious bulging condition in the root of the tongue. For this age, we normally won't think about anything like a fibroid or cyst. But I concerned about any period condition, so I asked her. She said she did have very severe period pain. She said that's okay, and I'm here to solve the headache and insomnia which influence her study at the moment. For the period pain she got for years, and she just take painkiller. So after this tongue reading, we confirmed the REM meridian problems, so we can do something on the REM meridians like 中极气海关元, and also choose some point for the liver qi blockage, which you can see both sides, the bed bulging, the midline a little bit moved to the right. So from here, we also can choose like Qimen, Taichung, Hegu, Ligo. And according to this tongue reading, you can also choose the herbs accordingly. And the result is dramatic, good. And the patient said, well, the sleep getting better, headache getting better, and also no period pain anymore. So you can see here the blockage in the lower jaw definitely can see less, the bottom bulging condition reduced. Do meridians, and Professor Yin just introduced some already, so we try to go through this a bit quick. The dual meridians is also quite important for the gynecology diseases as well. And Neijing, they mentioned if two are diseased, the spine is titanium and faint, so if you can get quite discomfort back. And also mentioned you can get drawing due to infertility and hemorrhoids, these kind of conditions as well. So dual meridians, there's quite a lot of point. It's also quite important for like fertility support. So we try to find out how to get the dual meridian signs from the tongue picture. Yeah, there's also two different kind of dual meridian signs. The first one is young deficiency of the meridians, which you can see the midline of the tongue is sucking all along, whole sucking all along the midline. And also there's cracks in the midline. It's not like the REM meridians, just a very smoothed out sucking. This is a lot of cracks you can see. And another sign is the obstruction of the dual meridians, which you couldn't see any sucking condition of the midline. It could be a bulging condition or interruption condition, and together with small cracks. And this is a patient with menopause condition, and her main complaint is joint pain. It's not much on the back pain, it's a joint pain. So when we find out these dual meridian signs, you just focus on the dual meridians with Professor Ng's seam needle method. It's a bit complicated to explain everything today, so you'll find out how to do this treatment in the future lecture. And I think this patient combined with some herbs for the dual meridians as well, which could be like 羌活、毒活、防风、荆芥、附子, etc. And the result is quite obviously the tongue picture looks a bit better as well. Tongue meridians disorder is as important as REM meridians, and because the tongue meridians can regulate the qi and blood of the 12 meridians and also adjust the flow of the zang qi and descending and ascending. The tongue meridian disorder could be tongue meridian qi reversed flow, or it could be deficiency of the tongue meridians. So it can cause different gynecology problems. If it's the tongue meridian qi reversed flow, we normally need to tonify the kidney and reduce the stomach. For deficiency of tongue meridians, we need to tonify the liver and kidney. This is the tongue signs. For tongue meridians disorder, if it's a bulging in the middle line and a sunken bottom on the root, that's tongue meridian qi reversed flow, which means kidney deficiency and the stomach area blocked. If it's the middle line of the tongue is flat and the root of the tongue root is sucking, this normally means tongue meridian deficiency. It's the treatment quite similar to REM meridian deficiency. This patient come to the clinic for headaches and period pain. And you can see from this tongue picture, there's tongue meridian sign here, bulging and sucking on the root, bulging all the way through. And also this patient got a bit heat in the upper jaw and cold in the lower jaw. It's upper heat and cold lower. This is quite common condition in the clinic. You can find from a lot of patients which normally comes with middle jaw blockage. We'll explain this in the qi movements later on. So we use some herbal products for this patient, which is 薄荷连翘双花 to clear the upheat, and 焦三仙 to clear the middle jaw blockage, and also 长柱 clear the middle jaw blockage and the dampness with 干姜. And we use 杜仲小茴香 for the lower jaw cold and dampness as well. So the result is dramatic. Diag meridian disorder. Diag meridians is quite, it's not only can cause problem with this diag meridian disorder not only caused vaginal discharge condition, there's a lot of other problems like uterine prolapse condition, the miscarriage problem, and also we can meet a lot of patients in the clinic with abdominal obesity. This all related with the diag meridian problem. We can see from here. This picture shows the like the diag meridian disorder, which is a line here. You can see, which means it could be a lower, the tongue root, the lower jaw, a bad bulging or sucking. It could happen for both. And also, you can see some white coating or white yellow coating on the tongue as well. We can see this patient. Yeah, you can see there's this patient come for in vaginal discharge condition. And from the tongue side, you can see this line between the middle jaw and the lower jaw is not that obvious. I think it's because the kidney area is a bit deficiency and the spleen area deficiency as well. So there's no obvious gap here, but the white coating is all spread, especially worse in the middle jaw and the lower jaw. It could be a diag meridian disorder. So we treated the patient with like Diame and Wendell through this kind of diag meridian points. And also, he got some disorder with the liver qi blockage as well. So when we also can choose Taichung, Hegu, you got this kind of qi these points for clear the liver blockage as well. And accordingly, we use some herbs for tonifying the kidney, spleen, and clear the dampness, heat from the body. So this patient also get really good result after the treatment. From Professor In's modern tongue diagnostic system, we also have a picture shows the Liu Jing diagnosis. They all important for gynaecology problem, but especially the Shaoyang, which is a triple warmer meridians, is more important than in treating and supporting like fertility problems and other gynecological diseases as well. Let's see what is the sign for triple meridians. There's also two different signs. The excessive syndrome could be the stagnation of the liver and gallbladder. You can see you can see on the side, both sides, there's a bad bulging condition on the side. This area quite thick, and also with tooth masks. And another condition with triple warm meridians is the deficiency syndrome, which caused by lack of vitality and the loss of water or vaporization. You can see in the tongue root, it's bad sucking. This patient looks bad sucking in the middle jaw as well, and with white and greasy tongue coatings together with tooth masks. We all know tooth masks means the dampness of the body. From Professor In's modern tongue diagnosis, we got more details. It's actually not only dampness. It could be spleen and kidney deficiency and influence the water vaporization to cause the tooth masks. And also it could be the Shaoyang blockage, which is the liver and gallbladder stagnation and caused the tongue on both sides about bulging, which can also cause tooth mask as well. And this is a patient with eczema condition. When patient with triple warm meridian disorder, we quite concerned about her Shaoyang condition. For example, this patient only come here for eczema, but because of her tooth mask condition here, and together with the kidney deficiency and spleen deficiency as well. So I asked her about like in the Shaoyang area, we can find out some problem like thyroid, breast condition, and also other gynecology condition. This patient said, yes, her period is not quite regular and got breast cyst as well. So when we do the treatment and concentrate for her triple warm meridians, you can choose the point like 中主、阳池、外观, this area. And together you can use some herbs for tonify the spleen and kidney, clear the liver qi blockage. And she also get a little bit heat in the upper jaw area. So we use some herbs for the upper jaw as well. And so after the treatment, it's not only her eczema getting better, her period more regular as well, and sleep condition better. Yeah, with modern tongue diagnosis, we also can diagnose the qi ascending and descending condition. And we can diagnose the qi condition from pulse diagnosis. But if you're not good at pulse checking, so tongue diagnosis can give you quite clear sign. where is the blockage, what's wrong with the qi movement. And Professor Yin just introduced this picture in her lecture already. So I just briefly concentrate three qi movement model here. One is the liver qi ascending and lung qi descending. This cycle we used quite a lot in the clinic, which means if the lung qi blocked, for example, the patient get constipation, this side, or get asthma, this side could be bulging or larger. If the liver qi blocked, the left-hand side could be bigger or more bulging. The second circle is the middle, spleen qi ascending and stomach qi descending. This is, you can see the sign in the middle jaw. This, when we concentrate for the middle jaw, this to move the qi, like to tonify the spleen and detox the liver. This treatment is quite powerful because this circle gets more power than the outside circle. So sometimes when you treat patient with liver qi blockage, you also do something to tonify the spleen qi and to improve this like circle for the treatment. And the last one is the water rays and the fire drops. This is quite common for patients with upper heat and lower cold condition. So with the qi movement in the body, it's quite important, and we use quite a lot in our acupuncture treatment. Yeah, this patient came to the clinic for delayed period and quite stressful condition. Yeah, quite a lot severe mental stress as well. You can see from the tongue picture, the left-hand side bigger than the right-hand side. As both sides is a bit bulging, but especially this side, this shows quite a lot liver qi blockage here. And when we do the treatment, we can use 太冲合谷、丘虚气门离沟 combine 列缺 to reduce this site, mainly concentrate to clear the blockage on the left-hand side. And at the same time, you can use, because it's also a spleen and kidney deficiency as well, you can use 太细太白 to tonify the kidney and spleen. And according to the tongue reading result, we use some herbs accordingly. So very quick, after a couple of months treatment, the patient period back to normal, and in the tongue picture, you can see a big improvement as well. With modern tongue diagnostics, it's quite important we use it for 脏腑 differentiation. So which means this is the upper jaw, the heart, and the lung. This is the gallbladder and liver. This is middle jaw, spleen, and stomach. This is lower jaw. So from the tongue picture, we can see quite a lot problem with the organs. For example, we look at the side of the tongue to see any liver qi blockage, and also after you confirm the midline, the left-hand side certainly bigger. So this is the liver qi blockage as well. From this part, Professor Yi just confirmed this is the heart condition, like it's really between the upper jaw and middle jaw here. You can see the heart qi and the yang condition. and spleen middle, and kidney the bottom. So you can see it's Qi deficiency, it's Yang deficiency, or from the side you can see any liver blood deficiency if the tongue is quite straight. And the same this area, this normally shows liver blood deficiency. We have a picture here. This patient came to the clinic because of the period stopped. Period stopped for more than a year. Amenorrhea. So she only used herbal product. You can see from here. Well, the kidney deficiency, yes, and spleen deficiency, yes, but there's obviously sign between the upper jaw and middle jaw, which shows the heart yang deficiency. So this patient, we can diagnose the heart, spleen, and the kidney yang deficiency, which could be the blockage caused in the lower jaw condition and blocked the Chongren meridians. So we use herbs for tonify the heart, tonify the spleen, and tonify the kidney, and also for the liver qi. She also get a little bit liver qi blockage, like xiangfu yu jing. And also we use some herbs to clear the blood stasis in the body as well. So that's sometimes when we treat the period problem, you need to find out the root of the condition, which means we need to find if any like liver blood stasis or like any yang deficiency. If not, you only use herbs for blood stasis, for blockage, it possibly won't get a good result. Yeah, this patient is also come for fertility support. There's obviously deficiency in the middle jaw, spleen area, kidney area, and also bulging on the side, both sides. So that's a liver qi blockage. So we give her treatment, the condition can change quite good. This is the menopause patient with hot flashes, quite bad hot flashes, and sweating, night sweating. And I use this pictures just to give us an idea. When you use the herbs, you can use more accurately. Like, for example, for quite a lot menopause conditions, they are kidney yin deficiency and kidney yang deficiency. So we know we need to tonify the kidney for both, but which one will be more like you can see each week changing. In the beginning, I think the kidney yin deficiency is a main concern. When you use more herbs for tonify the kidney yin, the tongue picture changed, like a little bit more heavy coating. So which means this is not quite correct. And then we changed the herbs with more kidney yang tonifying curves. So the symptoms and the tongue change into a better, healthier way. And that's all my lecture for today. And thank you so much for the listening. And we can next week we'll have another two fantastic lecture to share with everyone. And I'll give the I'll ask Professor in any other sense. Any questions you can also share with us.
Okay.
Can I ask a question?
You can ask questions.
Yes.
Yeah. Oh, well, just to say thank you very much. It was very, very interesting. And I wanted to find out a bit more about the triple warmer tongue, that
Yes.
you showed, and what sort of treatment would you suggest with that?
Yes, for acupuncture, we certainly will work on the spleen and the kidney meridians,
Right.
and also the triple warmer meridians on your
Okay.
arm.
Lovely. And with herbs, any particular herbs?
Yeah, again, if you get the deficiency condition with triple warmer meridians, it's normally tonify the kidney and spleen.
Kidney,
So we
tonify
can
the kidney and
use
spleen.
mainly it's yang deficiency with
Yeah.
the water reparation condition is not good. If you get a liver and gallbladder stagnation condition, obviously there's some other herbs like
Okay.
玉鸡、香附 kind of herbs we can use.
Okay. Thank you very much. Thanks.
Very welcome. Yeah, we have the course from Professor Ng for almost 4 months, which is 2 hours in a week, 3 hours in a week, 3 times a week, so 1 hour each time. So he can explain all of the diagnosis, treatment details with acupuncture and herbal therapy as well. So it will be quite beneficial.
Where are you based? Where do you live or work from?
Professor in London.
London.
We're based in UK, yeah. But all of our courses is online courses. That's the good point for tongue diagnostics. For pulse diagnosis, you can't learn online, but for tongue, you can. Yeah. Professor Ng, any other things for today?
No, I think that's, if anyone interested in this lecture, you can log into the website. We just finished the website.
Right, yes.
MTD. Okay. So you can see it to find more detail about mother tongue diagnosis.
Oh yes, in the chat, yeah.
In the chat, you can get this get the website to see more.
We have somebody just joined. about 4 o'clock. So that's a shame. So there's I think we'll share the recording with everyone. And you can also get Professor In's post with the website of the International College of Modern Tongue Diagnosis.uk.
Okay, I think if anyone no question, we'll finish this lecture today. Thank you everyone for attending this lecture. And also thanks Dr. Sun for the lecture to us. Okay.
Yeah. I shared the website again. I think some people joined us a bit late. Yeah, you can have some other information on the website.
Okay, good. We can finish now. Yeah, if no question. Okay, goodbye, everyone. Okay, bye.
Goodbye.
Bye.
Goodbye.